Okay, so good morning and good evening, everyone. We will be starting in just 1 minute. We'll be starting in a few seconds. Okay, so good morning and good evening, everyone. Thank you for joining us for today's webinar on Innovating Healthcare with Generative AI. My name is Vishesh, and I will be your moderator for this session. We're excited to have you here, whether you're joining us from the PST zone or from the IST zone. So today, we have the pleasure of hearing from Shraddha Dubey, who leads ACL Digital's data science team in Bangalore, in India. With over 9 years of experience driving innovation across industries, Shraddha brings a wealth of knowledge in data science, machine learning, and computer vision. She holds a master's degree in data science and has collaborated with diverse clients to develop tailored AI solutions. Not only does she excels technically, but Shraddha is also an exceptional communicator, adept at translating complex AI concepts for clients. Her impressive portfolio includes optimizing content strategies at Disney and developing advanced AI models for digital forensics. We also have with us Kranti Kumar N, who heads the AI and ML practice at ACL Digital. Kranti is a seasoned AI ML leader with over 15 years of experience in AI and ML. Could you change the screen, Shraddha? Thanks. Before we dive into the exciting insights that are waiting from Shraddha's side, let me introduce our parent company, the Alton Group. The Alton Group is the world's third largest technological consulting and engineering company, headquartered in France, Europe. With more than 50,000 employees deployed globally, we have served over 6,500 clients and continuing to grow. Alton boasts a presence of in 30 countries and achieved a turnover of $4 billion in the last fiscal year. Over the past 30 years, Alton has emerged as a leader in technology consulting, digital engineering, and IT services. Our workforce composed of 88% engineers. It undertakes complex and highly technical digital transformation and engineering projects across the value chain for the most prestigious companies in various industries. Next slide. In terms of our global workforce, in Europe, we have 36,200 employees, and in the rest of the world, we have 17,900 employees. As we move forward, I want to remind everyone that you can type your questions below in the Q&A box available. We will address them at the end of the session. Now, without a further ado, I am thrilled to hand over the mic to our esteemed speaker, Shraddha Dubey, who will guide us through today's agenda. Over to you, Shraddha.
Thanks a lot, Vishesh, for the introduction. Hello, everyone, and welcome to this webinar on generative AI. Today, we will be taking a deep dive into current landscape of healthcare ecosystem. We will discuss the existing challenges the industry faces, and we will explore some key market trends that are shaping this future. And then we will shift our focus to generative AI and its capabilities. Finally, we will delve into real world use cases of GenAI in action. We'll see how this technology is being implemented to improve patient care, streamline processes, and accelerate medical breakthroughs. By the end of this webinar, you will have gained a comprehensive understanding of how GenAI is poised to transform the future of healthcare. This is the agenda for today's webinar. Now let's delve into the world of generative AI, often abbreviated as GenAI. GenAI refers to a type of artificial intelligence with remarkable ability to create new as well as original data. Unlike traditional ML models that were trained to recognize or classify, generative AI models learns the underlying patterns and relationship within a data set. They then leverage this knowledge to generate entirely new and original content. This data comes in various forms, including text, image, video, even audio. Now, but generative AI is a broader field. What comes to mind the first we think of generative AI usually is the language models. We have all worked with and interacted with ChatGPT, Gemini, Gemma. Few of these, all of these are language models where you input a language, you get the language out. But there are vision models as well under this umbrella, which takes an input as an image and can generate video or audio as well. Same are speech models, which takes in a speech as an input and can have output in form of speech as well as text. So that's the small and short introduction for generative AI. Let's shift gears and explore the exciting futures of generative AI in healthcare. The market is brimming with potential, and analysts are taking note. According to various projections, generative AI is predicted to contribute about 7 trillions to the global GDP over next decade. This is a testament to the transformative power of this technology across various industries. Now, zooming in on healthcare specifically, the market size for generative AI was valued at 1.8 billion in 2023. A 2023 report by Goldman Sachs predicts a significant leap, with the market reaching a whopping 22.1 billion by 2032. This translates to a compounded annual growth of 32.6%, highlighting the rapid adoption and immense potential of Gen AI in healthcare. But this but the impact goes beyond this. Generative AI also holds a potential to eliminate significant portions of estimated 1 trillion waste in healthcare spending every year. This waste can stem from various factors, including inefficient care delivery, fraudulent activities, lack of coordination, and so on. By streamlining the process, improving accuracy, facilitating earlier intervention, GenAI can play a crucial role in optimizing healthcare resources and creating a more eco effective system. Now, a 2024 report by Deloitte Center of Health Solutions indicates a high level of interest in Gen AI among leading healthcare companies. According to this survey, 75% of leading healthcare companies are already experimenting with Gen AI, or at least they are attempting to scale it to use across the enterprise. There is also a strong focus on governance. About 82% of the companies indicating that they currently have a plan or have already implemented a governance and oversight structure for generative AI. Industry leaders see this technology as a way to improve efficiency. That's about 92% of them. And they enable quicker decision making, as per 65% of them. This could encompass streamlining administrative tasks to optimizing resources and automating repetitive tasks. Now, the healthcare industry, while constantly innovating, faces some significant challenges. These challenges hinder its ability to deliver optimal care and create a sustainable future. One of the most pressing issues in the ongoing labor shortage. This includes lack of qualified doctors, nurses, and other healthcare professionals. This shortage leads to increased workload and strain on existing staff. When stretched too thin and facing constant pressure, many of these healthcare professionals experience extreme burnout, impacting their well being as well as potentially compromising patient care. Another factor to it is financial stability of healthcare system. Declining profitability due to rising cost and stagnant reimbursement can limit resources and hinder innovation. Finally, despite advancement, we see persistent issues with healthcare outcomes. This could be due to factors like limited access to preventative care, disparities in care quality, and rising burden of chronic diseases. Now, let's understand the challenges that are plaguing the healthcare ecosystem. Let's explore how GenAI can potentially revolutionize the way we deliver and experience care. GenAI offers unique advantages for various healthcare sectors within the healthcare ecosystem. Let's break it down. For patients, generative AI can lead to a more personalized and efficient healthcare journey. GenAI can analyze patients' medical history, genetics, lifestyle data to assist in creating a tailored treatment plan. Streamline appointment by optimizing and scheduling appointment management, reducing wait time, improving overall patient experience. GenAI models can also analyze patient symptom and other data points to recommend an appropriate care setting. This can be in an urgent care visit or a virtual consultation or even a referral to a specialist. AI powered assistants can provide patients with on demand access to information such as appointments, schedulings, even the basic health screening as well. Now, moving on to healthcare providers. They are facing immense pressure, uh, but generative AI can be a powerful ally to them as well. Gen AI can analyze amounts of medical data to identify patterns and trend that may not be readily apparent to human healthcare professionals. This can lead to improved diagnosis, treatment planning, and overall care quality. By automating tasks like data analysis, report generation, GenAI can free up valuable time of clinicians to focus on patient care. Additionally, AI can optimize resource allocation, streamline workflows, leading to a significant cost saving. For payers and integrated delivery networks, GenAI can be used to reshape healthcare operations by innovating platforms that are streamlining processes, improving fraud detections, and optimizing resource allocation. By identifying the pattern of waste and inefficiencies, AI help payers and providers reduce overall healthcare cost. AI can also streamline claim processing, improving care coordination, facilitate more effective flow of service throughout the healthcare system. AI can be harnessed to develop robust care management model for the payers uh, to proactively identify patients that are at risk and intervene with preventative measures. So these are just a few examples how GenAI can assist. Uh, but before we delve deeper into how GenAI can help, let's establish an understanding of what are the key players that we will be discussing today within the healthcare ecosystem. First, we have providers. These are individuals and organizations directly delivering medical services to patient. This could include doctors, nurses, specialists, hospital clinics, and so on. The next we have payers. These are organizations that finance health services. They may provide services directly or reimburse patient for a covered expenses. Next, we will discuss medtechs. This refers to companies that develop, manufacture, and distribute medical devices, equipments, and softwares. This could be diagnostic tools, surgical tools, EHR systems. Then another important one is services and operations. These organizations provide non-clinical services to support a healthcare ecosystem, such as ambulance service, medical billing companies, pharma benefit managers, and last but not the least, we have public health agencies. These are government agencies at various levels, such as local, state, federal, international, responsible for protecting and promoting public health. So these understanding of these stakeholders and their roles is crucial for appreciating how Gen AI can impact different aspect of a healthcare system. Now, understanding the specific needs and challenges faced by each healthcare within the healthcare ecosystem is crucial. By addressing individual needs, AI can revolutionize how healthcare is delivered. So let's get started. First, let's discuss about providers. Providers often have exhaustion and stress that are major concerns, leading to a decreased job satisfaction, medical errors, and potentially lower quality of care. Then we have administrative duties like scheduling appointment, managing patients, reports, referrals, and these things also add additional burden to already overworked healthcare professionals. Gen AI powered analysis of vast data can help all these professionals in identifying patterns, insight, and they can aid in diagnostic, treatment planning, and personalized healthcare approaches. Let's move on to payers. Some of the problems that they face are fraudulent activities within the healthcare system, uh, that which creates a significant financial burden for payers. Another one is keeping members engaged and proactive about the healthcare can be difficult. Low engagement can lead to a higher cost and a poorer health outcomes. Generative AI can identify fraudulent patterns and detect anomalies and suspicious patterns indicative of potential fraud. GenAI can also predict scenarios with a higher likelihood of a fraudulent activities, which allows payers to proactively implement preventative measures. Let's discuss a little bit more on medtech. The future of healthcare lies in tailored treatment and therapies. Generative AI can assist in optimizing medical devices design, and which can design and stimulate new medical devices with tailored functionalities and improved patient outcomes. Let's discuss on services and operations. Data overload is uh, one of the bigger challenges that the service sector is facing. The healthcare system generates massive amount of data, but extracting meaningful insights can be challenging. Generative AI can assist here. It can analyze unstructured as well as your structured data, such as your images, your document results, your X-ray scans, CT scans, improving data searchability. AI can analyze sensor data from medical equipments to predict potential failures and enable proactive maintenance, minimizing downtime and as well as ensuring smooth operations. Then we have public healthcare agencies. Their biggest concern are timely identification and response to outbreaks that are crucial here in this case. AI can analyze huge amount of social media data, news reports, and healthcare records to identify potential outbreak in a real time, enabling a faster intervention. It can be used to identify areas with a higher risk of outbreak, allowing for targeted resource allocation and a more effective public healthcare campaigns. Now, by understanding these stakeholder needs and capabilities of GenAI, we can begin to design and envision a future where technology transforms healthcare delivery for everyone. Now, we know that generative AI holds immense potential for healthcare, but it's crucial to also navigate the regulatory landscape to, to ensure responsible development and deployment of these services. Let's discuss three key regulations that we will consider here. The AI Act. There's been a lot of buzz around this, and it has recently come into effect from June 2024. AI Act classifies AI system based on risk. High risk sectors and healthcare is classified as high risk, and it faces a stricter regulation. This includes uh, these regulations include transparency on training data, explainability of AI model, and human oversight throughout the development life cycle. The Act also emphasizes mitigation of bias, ensuring a fairness in AI powered healthcare applications. The next regulatory compliance that we'll discuss is GDPR. It mandates a strong safeguards for protecting patient data privacy. This includes obtaining informed consent for data collection and use, implementing robust data security measures, and ensuring patients' right to access and control their data. This ensures when using patient data for AI development or training, anonymizing techniques should be empowered wherever possible to minimize privacy risks. Next is HIPAA, that stands for Health Insurance Portability and Accountability Act. For organizations that are operating within the United States healthcare system, HIPAA compliance is an essential when using AI. HIPAA safeguards patient data like medical history, diagnosis, treatment plans, billing informations, etc. It mandates specific security and privacy standards for protecting personally identifiable information, including measures to prevent unauthorized access, disclosure, or use of patient data. We at ACL Digital understand these regulations and adhere to it very strictly. We can ensure ethical and responsible development and deployment of generative AI solutions in healthcare, fostering trust and maximizing these applications' potential to improve patient outcomes. In the next slide, we will explore some of the key players into generative AI's market. Harman, a Samsung company, has recently developed Health GPT, a generative AI model focused on improving healthcare. Oracle is offering clinical digital assistance that streamlines clinical workflows and reduce administrative tasks. Another name that we often hear is Google, that is actively collaborating with healthcare organizations like Mayo Clinic, Bayer Pharmaceuticals on various generative AI projects. A few of the names that you must have heard is MedPalm 2, which is a powerful language model being explored for applications in drug discovery and medical research. These are just a few examples. The landscape is constantly evolving. As generative AI technology matures, we can expect even more exciting advancement for established players and new players alike. Let's delve into some of the specific examples in real time how generative AI is addressing pressing needs in the healthcare system. Here we will discuss a use case with medical documentation. We often see that doctors and nurses spend a significant amount of time documenting patient interactions through dictations. As all of us have gone to hospitals, a common theme that we see is you have a triage with a nurse, then you go and explain your symptoms and your uh, illness to a doctor. All these are noted down by each of these mediaries that you pass through. Now, this process is uh, dictations and subsequent transcription creates a backlog in updating medical records, distracting from valuable patient care time. Another problem is in the traditional dictation softwares can be it struggle with complex medical terminologies, which leads to errors in records. Traditional transcription services can also be expensive, which places an additional financial burden on healthcare system. With generative AI, uh, it can rescue the professionals here. How, you may ask? With help of AI, doctors and nurses can dictate notes directly to AI, which can then convert to digital text in real time. GenAI models can extract these data points, save it in a structured format. AI can also generate comprehensive medical reports based on data extracted, saving clinicians significant time and effort. Another area GenAI can assist is sorting through vast amount of patient history. Generating a medical summary of a patient, it can provide a clear timeline of patients' illness throughout their history and medications and all the procedures that they have gone through, which assist a healthcare provider in a faster analysis as well as saving critical time to diagnosis. AI can assist in appropriate medical coding. It can assist there. AI can identify and categorize specific medical entities within the dictation, such as what medications they have gone through a patient, what are the allergies, past lab results. All this can facilitate easier information retrieval as well as storage along with analysis. When we talk about the benefits, would be for all these applications of GenAI would be improved accuracy. GenAIs can significantly improve accuracy, minimizing the error in medical record, which reduces cost associated with medical record and improve the quality of downstream applications as well. It provides a faster turnaround time by AI transcriptions, which creates a transcription almost in real time, allowing for updates to patient charts within minutes. The faster turnaround time improves care coordination by ensuring all healthcare providers involved have access to the latest patient information, which facilitate more informed clinical decision making and potential leading to improved patient outcomes. When a when a healthcare provider spends less time on documentation, they can interact with more with the patient, building a better rapport with them and delivering a better care. So this is just one example of how generative AI can work and enhance your workflow. In the next slide, we will explore another use case. Uh, Now, imagine a care facility or at home patients that are under care, which often struggles to provide uh, under care. They need round the clock access, whether you're talking about care facility or a patient who is often at home and has on a scheduled visit from a doctor and a nurse. What happens in this situation is these patients are under care but still often struggle to provide a continuous monitoring of these residents, especially those with chronic conditions or cognitive decline. Uh, the challenges here are that traditional monitoring methods are reactive approaches. The residents are paid attention to when they exhibit a physical symptom. This reactive approach can be particularly risky for patients with chronic conditions or, let's say, underlying mental health condition. These are the cases where an early detection of subtle change in vital signs or activity levels can be very crucial for preventing complications and as well as improving healthcare outcomes. Now, when we rely solely on staff observation, even the most attentive caregiver can miss the subtle signs of health deterioration, particularly during night hours. Human fatigue and the need for multiple residents can limit the ability of a staff to continuously monitor each resident. Now, generative AI offers a proactive as well as a data driven approach to solve this. A network of wearable sensors and smart devices can be deployed in a resident's room to collect their vital signs such as blood pressure, heart rate, their activity levels, their sleeping patterns. And generative AI can process this multimodal data from various sensors and extract valuable insight. AI model can be trained on the historical data of patients to learn their typical pattern in vital signs, activity, and sleep. Deviation from these baseline flag, uh, this baseline can be flagged as a potential health concern, allowing an early intervention. Now, GenAI's ability to learn and adapt over time is particularly valuable in this context. As the GenAI model gathers more data on each resident, it becomes more adept at identifying even the most subtle signs and anomalies in an individual. This personalized AI can provide early interventions by communicating even with the patients. Now, by combining historical data and medical information, AI can develop a personalized health profile for each of the residents, which enables the system to identify anomalies for each individual's baseline. Another step in the pipeline is generating real time alerts. With AI for care staff, when it detects any anomalies, this can indicate a potential health decline or medical side effect or a risk of a physical fall. Now, this early detection or flagging of these anomalies can allows a timely intervention and a potentially prevents more serious health complications. Gen AI can go beyond simply by generating alerts. It can analyze the health profile and it can recommend a potential course of action as well to a care staff, expanding the intervention process and improving on the patient outcome. Let's talk about some of the benefits by implementing these solutions. An early detection of health concerns empower your care staff to intervene promptly, potentially preventing more serious complications and improving healthcare outcomes. Now, AI alerts prioritize residents' needs, allowing caregivers to focus their attention on residents that require immediate attention. This optimized staff workflow will ensure residents' care is provided whenever they need it the most. Now, continuous monitoring with AI helps ensure residents' safety and well being, offering a peace of mind to families as well as the residents themselves. The ability to personalize care plans based on individuals' needs and preferences uh, using data driven insight from AI leads to an overall improve in the quality of care. Now let's discuss another use case where we implement a different angle. Now we every time we all have been to the hospitals, and we do know at some point in our visits we have gone through medical imaging. Either it's an X-ray scan or a CT scan, an MRI. We know the kind of data that gets image data that gets created. Now, radiologists play a critical role in the healthcare system, interpreting these medical images like X rays, CTs, and MRIs to diagnose diseases and guide treatment decisions. However, radiologists face a growing backlog of images to review, leading to a potential delay in diagnosis and treatment. Now, here is another way where generative AI offers a solution. But before we discuss the solution, let's discuss the challenges. The sheer volume of images can be a challenge in itself. It overwhelms the radiologist, leading to delay in diagnosis as well as treatment. Some images may be a clear cut image and require minimum interpretation, while others may be more complex and requires a high level of expertise. However, the growing backlog does not prioritize these. It simply sorts through first in first out method, which which creates a lot of challenge. Another problem with increased volume is the uh, and another challenge with is the increasing volume and complexity of medical images strains the resources. Time consuming analysis of a straightforward image can detract from the time the radiologist could have devoted to a more complex solution, requiring their expertise. Delaying these reviews can affect a patient outcome, as well as it can cause fatigue to the radiologist itself. Now, let's talk about how generative AI can assist in this situation. AI model can be trained to classify images based on different categories. Based on these categories could be the urgency level of of the radiologist. It can also classify the images based on anatomical region as well as potential abnormalities that it finds. This classification allows for prioritization of critical cases that require immediate attention. Using GenAI to analyze image and generate primary reports is another area that it can we can help with. This pre-screening process saves radiologists a lot of time by filtering out clear-cut cases as and highlighting the areas where an expert opinion is required. By automating routine tasks and prioritizing critical cases, AI powered triage frees up the radiologist's time to focus on complex cases. This leads to more balanced workload and potentially reducing a burnout, improving overall health of physicians as well. The benefit that we gain are by prioritizing critical cases, AI can expedite the diagnostic process, and it can improve the radiologist efficiency as well. AI can automate these tasks so the radiologist can focus more. Now, another benefit is reduction in the backlogs. The AI workflow, this workflows streamlined by AI can help to reduce these backlog images. Generative AI has the potential to go beyond this triage as well. It can happen by assisting radiologists in image interpretation tasks. For instance, AI model can be used to segment anatomical structures within the images, identifying subtle abnormalities, and even generate differential diagnosis, all of which can aid a healthcare provider in making more accurate and informed diagnosis. In conclusion, GenAI is poised to revolutionize medical image analysis, improving workflows and expediting diagnosis, which ultimately will enhance patient care and outcome. So these are some of the use cases that we have identified and highlighted. There are much more that we have undertaken and working with. Let me show you one example where one solution that we have developed at ACL Digital. Here's a small video.
By harnessing the power of artificial intelligence, healthcare providers can offer more personalized, proactive, and efficient care to patients. This transformative approach promises to improve patient outcomes and enhance the overall healthcare experience. Patient monitoring presents several challenges in healthcare settings. Manual monitoring is time-consuming, while fall risk assessment demands vigilance, visitors' time, monitoring the patient mobilization, and generating the reports becomes stressful. ACL Digital has introduced a groundbreaking solution with AI-powered eye care patient observation. So, eye care gives the best solutions, and it is powered by AI. Automation facilitates nurses in accessing real-time patient status, alerts and identifying fall risks of the patients. It also streamlines visiting hours and enables the generation of multi-category reports for patients at any time. Join with ACL Digital's eye care patient observation to create a revolution in healthcare experience.
That's all from my end. Vishesh and Kranti, do we have any questions from the audience from the webinar, please? Over to you.
Yeah, thank you, Shraddha, for this presentation. Okay, so now we have reached the Q&A portion of our webinar. I would like to insist all the participants here that if you have any question, please type them into the Q&A box, which is available down there on your screen. Okay, so let's move forward and see what questions we have from the audience. So yeah, there are questions. The first one says, Normal doctors forget medicines prescribed earlier to patient sometime. Is there any process to capture this data accurately? That's the first question.
Kranti, do you want to take this one?
Yeah, sure. Yes. So if the question, if I understand correctly, so if the conversation is happening over a document or it's being recorded or transcribed, definitely whether AI or generative AI, they definitely can capture this medical related information, whether it is medicine or it is any symptom, whether it's by the doctor or the patient. So it can be captured definitely, and it can be recorded, and even the schedules of those particular medicine usage can be captured and properly registered as well.
Okay. So is there any process to specifically to it? Because I guess the person is asking about the process here.
Yeah, so in LLMs, the process is right, like it's like asking a question to LLM, specifically using some prompt engineering. If we need anything specific, if they are talking about medicine, we have to specifically talk any specific thing that we are talking about, like say, hey, I need to understand, is there any medicine being involved in the conversation? Can you please list down the context along with the medicine? So that should be the prompt. So it might give all the medicines that has been described in the conversation between doctor and patient, and it can list it out properly. Or in a traditional generative AI, there are specific models that are trained on medical data, which we can use and apply a technology called NER, like named entity recognition systems, and they can definitely extract these medical entities. But again, we'll have to do some post processing after that, understanding which one is a medical term, which one is actually a medicine. We have to apply that post processing techniques. Then it is easy. So that's a traditional process where we have to do multiple steps. And LLMs is, since it is trained on multiple amounts of data, it might give a better output and reduce our effort of actually doing the post processing and stuff, which we can do with a simple prompt engineering. But caution, definitely a normal language models might not give accurately. So we might have to go for medical models, like Shraddha was talking about from Gemini, from Google, the Palm models. They give much more accurate information than traditional LLMs like ChatGPT and others.
Okay. Thank you. Thank you so much, Kranti, for answering this. Okay. So next question we have, does Gen AI or is Gen AI ready to support different languages?
Um, when we're talking about different languages in terms of interpreting different documents into English language, or if you're talking about conversational interpretation of languages, uh, for the conversational piece, yes, generative AI has already started, as I have mentioned in one of those use cases, that multilingual uh, generative AI is there. It can convert in real time languages from different other languages to English and vice versa. Say French to English, English to French. And recently, OpenAI had released latest GPT models that they showcase that it can do it in real time. So the answer is yes. When it comes to converting medical documentation into different languages, it is progressing, but there hasn't been proven use cases as of now which can convert physical documents, although the research is going on and it's not too far along that we would be there.
Okay. Okay, Shraddha, thanks. So the next question is here is, will the slides be shared? Okay. So those who are seeking the slides presentation, let me tell you that the video of this webinar's recording will be uploaded in our YouTube channel. So you are free to go and take a look back at this whole webinar session that happened today. So by tomorrow, you will get the video of it. Okay, so the next question says, how can your Gen AI solutions integrate seamlessly with existing healthcare IT infrastructure? So he's asking about the compatibility. of our GenAI solutions?
Okay, I'll take this question.
Yeah,
Yeah, so there are two types of generative AI, how we can deploy these models. So one is using the cloud APIs that are provided by ChatGPT and others, and we can build an application which can seamlessly integrate with any kind of infrastructure, whether it is EHR or our ERP systems that are available in-house. Um, so if you are concerned on top of the compliance issues, that's how the solution has to be generated around it. It's nothing to do with whether it is AI or GenAI solutions. So they are typically API controlled systems. So like any other system that we have built, non-AI solutions, so it's an API based system. So GenAI is exactly same how we integrate it. Only concern that comes is what kind of data goes into generative AI system is where we have to understand. Suppose if I have to pull data from EHR, that's where I think the major concerns is going to come. What kind of data we are pulling out of it? Definitely, there are restrictions like we cannot pull private information out of these EHR systems. If anything that is coming out private, then we have to definitely use some kind of masking technology to eliminate any private information. um, so there are several other techniques to do that. Again, GenAI can do that, but that makes no sense because again, we'll have to push data out of the system. So we generally use internal logical systems or traditional AI systems, which are in-house along with the restricted environment. We'll process the data. We'll see if there is any sensitive data. We will mask it or we remove it. And then we will take it out of the system so that it doesn't affect our system and comply with the regulations and others. That's how we kind of restrict and to remove any kind of abnormalities when things are going out of the system, or even while coming into the system, we'll make sure the Gen AI is actually creating something meaningful. And if there is anything that is non-reasonable, it will go for a verification. A human has to verify before we push it back into the EHR or ERP systems.
okay. Thank you, Kranti, for answering that question. So the next question is, are some of the use case AI or Gen AI specifically, as AI has targeted some of the use case you presented over last few years? Am I trying to understand AI versus Gen AI? Because I'm not clear what exactly the
Okay,
question.
I got the question.
Okay.
Yes, some of the use cases what we discussed is kind of a mix of both AI and Gen AI. Definitely. So AI versus Gen AI, yes, whatever Gen AI is capable of doing, AI is already doing. But as I explained in the previous answer, um, what is the different steps involved when we are doing traditional AI? The effort required to build an application is multifold. The pre-processing and integration, a lot of other things are coming up. But in Gen AI, the efforts are coming down since the model is capable of understanding and natural language for doing pre-processing or for doing any post-processing, or even in formatting the output in the way that we want it. For example, we can use Gen AI and say, hey, format my output in this particular format with this key value pairs and give me in a Gen AI format, or sorry, in a JSON format or in XML format. Gen AI is capable of doing it. So that reduces me a lot of effort. Still, AI and Gen AI are doing almost the same, except in the content generation part where Gen AI is exclusive. AI is unable, was not generally be used to create data. Other than that creation of data, all the use cases points we discussed are primarily connected to both AI and Gen AI are same, but some areas we prefer Gen AI because it is faster and reduce our effort. But we'll again drop back into AI due to the concerns of security and privacy. We will step back and see which is more accurate. And Gen AI has a lot of limitations for some mathematical relation events or something like that. AI is still more preferred area. So we will prefer AI over Gen AI in some scenarios. So all goes hand in hand where we feel the effort is more required on AI side and the accuracy is comparable, then we'll go with Gen AI. If we feel that AI is not, the Gen AI is not good enough, then we will definitely go back to our AI and do the rest of the things in AI.
Okay. Thank you, Kranti, for answering that. So the next question is from Vishal. He's asking, how can generative AI enhance remote patient monitoring, particularly in improving data accuracy and providing predictive insights for proactive healthcare management?
Okay, let me take that question as well. Again, as I told, it's a mix of both AI and generative AI together. So we use generative AI to identify few aspects of this particular solution. It's a lot of modules in the solution, but you're talking the remote patient monitoring is not just watching a patient or taking their data and putting it up. So we'll have to utilize some kind of agents, AI-based agents, for example, that the patient has been taking the medicine or not. So to maintain that data like drug adherence, we will have to monitor them using computer vision technology. But GenAI can help you to optimize it and put in proper format or something. We can use it. So it all depends on how the data is being generated, how we can utilize it. So the process has to be redefined. If we are specifically interested in putting GenAI into the picture, then we will have to design the solution in such a way that it accepts and empowers uh, the system to utilize the GenAI. Otherwise, it's a pure data system because data accuracy and predictive insights and all is not the power of generative AI. It's all goes back to our traditional ML and AI systems. So it's up to the how we want to build our solution matters how we can use GenAI there. So there's no straightforward answer here because improving data accuracy using GenAI, unless until it is defined in such a way, it is not a right way to approach the challenge because using a traditional AI systems or ML systems can improve it much more effectively than GenAI because GenAI's power is not that. But we can use GenAI in some aspects. Just to give a quick answer, Vishal.
Thank you so much, Kranti, for answering that. So next question says, is this eye care product developed by ACL Alton? Are there healthcare providers using this app or solution?
Yeah. Yeah, it is by ACL Digital. So we have developed this as a requirement from a couple of our existing clients. So this is a solution defined in multi-fold. Like there is a requirement, we build a piece, and there was another requirement for another client, so we build another piece. So this we consider as an accelerator rather than a solution or a product. We call them accelerators. So we built that piece by piece as the requirement keep coming from different clients. And it is being used. If you ask, yes, we have deployed a couple of POCs with some clients. They are being evaluated and they do not take entire solution because we are not a product company. So we are a service company. So they ask, hey, this piece is very good. So can you implement in our existing solution? So they will take that as a small piece rather than the entire solution as such.
Okay. Thank you. Thank you for answering that. Okay. The next is from Ranu Ramalingam. He is asking, are you developing any auto content generation capabilities for regulatory submissions? I'm sorry.
I think it is going to pharma side, but yeah, we have another solution called, not recalling the exact name, but it's in our website. You can check it out. But exactly not the complete content. The accuracy is still very limited because all the models, as I have previously told, are not medical models, except the latest Palm 2 model is quite acceptable, still not up to the mark of regulatory submission level, but they can enhance, I would say, or fast track our submission, like, underwriting or writing processes. But still, it's a research kind of an area. So a much more sophisticated, fine-tuned model for the regulatory compliance kind of structure can be there. But we have done something similar, as I told, which can develop our TLFs, the table, list, and figure kind of systems. We have automated that process. If given a data set, the AI can take up the data and pull on any graphs or tables that are regulatory requirements. That will come up, and a summary of that will be given by GenAI, which a human can take quickly and rewrite in the way that regulatory accepts. But how the regulator is accepting, that is a human still. We are not yet able to do a good submission for that. So it's still in a R&D mode.
Okay, I see. Okay. So the next question is from Ali Yusufi. He is saying that they're developing and diagnosing treatment for eye diseases, and they're looking forward for validation and tests. So what should they do?
Okay, and diagnosis and treatment.
Yes.
So I mean, again, it's a very focused question. I don't know what exactly you mean by eye disease. If you are taking an image as an input, so there should be a image or a reference images which says, hey, this is a perfect image of an eye, or a particular component of an eye, and this is a disease or anomaly in the eye. So generative AI, the one that Shraddha was explaining earlier, which can detect some anomalies, that can definitely help to detect if there is anything abnormal that is present in the eye. Let's say there is a white spot or a red spot in the eye, which we need to detect. That is possible with GenAI, but that is only part of it. Like, it will not be able to tell, hey, this is the problem, this is exactly this disease, and this is the exactly treatment. That is called high risk application. According to the current AI Act, it is not, none of the AI models will be able to tell it because it is against the AI law. But it can identify that there is a reason, or there is an area in the eye or any image that we give which is abnormal and it is not right. It can point out and trigger to tell like this is the place, and it can also refer to some reference documents telling these are similar cases from previous treatments, and this might be a possible case, and it can give the case studies from the previous studies which can be connected together. How I can tell this very precisely, we have done something similar in the dental kind of scenarios, not in the eye scenarios, which is a low risk, I would say. But again, we would not be able to diagnose what is the problem there or what is the treatment that is necessary there. We can just say this is a problem and these are the relevant use cases previously been studied, so that the diagnosis person can refer to these documents and figure out themselves with a manual effort what can be the treatment. AI is not allowed to do that, and it is against the regulatory authorities.
Okay. Thank you for answering that, Kranti. Next question we are having: can your Gen AI models explain their reasoning behind generated outputs, particularly when dealing with high stakes medical decisions?
Yeah, that's a good question. So explainability or interpretability of LLMs is still a R&D. Some of the corporate models, I mean the cloud models has been trying to implement that, like Perplexity or Google. They have been trying to refer, putting down what I can say as the reference for the above content being generated, so that people can refer to those websites or links. They can verify where is the source of this data that it is coming from. But again, that is not very accurate. Still, it's an R&D field. So as of today, even we are following a lot of research institutes. The interpretability or the explainability of LLMs is still an R&D area. Currently, it is not there. That's why the AI Act specifically says, since we cannot control how the output comes, we should know what is the input to the model. That the data that is being used to train has to be properly regulated, properly monitored, so that the bias of output can be eliminated a bit. So that is how the rule has formed, one of the major rule in the AI Act. But to answer the question, at the moment, any high risk application, like you mentioned, the medical decision kind of phase, has to be regulated in terms of how the model is trained, but not in the output. The explainability is still a big question, and it's still a big black box kind of a model in GenAI.
Let's see. Okay. Thank you, Kranti. And there was one other question which was asking about our YouTube channel. And yeah, so I guess these are all the questions that we have received till now. There is no other questions as of right now. So I would like to appeal to the people here. If there are any other questions, type it down, or else we can conclude the session. We'll wait for 1 more minute. Okay, so I think that there are no more questions. So it's time to conclude this session. I would like to thank you all for your questions and active participations. And big thanks to Shraddha for sharing her experience and expertise with us today. We hope you all found this webinar information and engaging. As we wrap up, I'd like to remind you this recording will be available on our YouTube channel. And our YouTube channel name is ACL Digital. So you can just type ACL space digital. You'll get the YouTube channel. You'll get the recording there within 24 hours. If you have any further questions, you can type it down before we leave, or else we can just simply say adios to everyone. Thank you once again for joining us today. Have a great day and night ahead.
Thank you all.
Thank you all.
Thanks, everyone.